Cancer Awareness Month. 1 out of 8 women will be diagnosed with breast cancer in their lifetime. Breast density is a risk factor which affects many women, but with new technologies such as 3D and Smart Curve, Washington Radiology is providing patients with a more comfortable and more accurate mammogram. Here to share more information is Dr. Agnes Holland. So welcome. We're happy that you are here rather, and that there's new technology that's going to help us in this fight against breast cancer. So let's start off and talk about what do we as women need to know about the mammograms and Smart Curve and versus the old technology. Spill it.
Well, first of all, the most important thing in all of this is what is your breast density?
Yes.
Breast density, breasts are made up of glandular tissue and fatty tissue. Glandular tissue is a tissue that you produce, that you make breast milk with.
Okay.
And that shows up white on a mammogram. Fatty tissue is gray.
Okay.
So if you have dense breast, you have a lot of white on your mammogram. Dense breast tissue is normal.
Okay.
About 50% of women have dense breast tissue on a mammogram. The most important thing about dense breast tissue is really what everybody needs to know is that it actually may be associated with an increased risk for breast cancer. There's been several reports that have shown that if you have dense breasts, you could have an elevated risk that is as high as somebody who has a first-degree relative with breast cancer, such as a mother or a daughter or a sister. So it's very important to know your breast density.
Okay. And that's something that you can find out from your first mammogram moving forward.
Yeah, and that's actually the only way you can find it out.
Okay.
You have to get a mammogram to figure out your breast density. Just because your breasts feel lumpy or thick, that doesn't mean that they're dense. They could be fatty. Fatty tissue could be feel lumpy.
Okay.
But it's really the density on the mammogram that you have to figure out.
Okay. So how does a woman learn what's normal and what's not normal from her regular mammogram?
Well, you need to do self-exam every month. That is very important. You also actually need to find a radiologist to read your mammogram who is subspecialized in breast imaging.
Okay.
You're good at what you do every single day. And at Washington Radiology, we're subspecialized because we believe that you can only provide high-quality interpretation if you do it every single day.
Okay.
Yeah.
So it's kind of like learning a new computer. The more you do it, the better you get.
Absolutely.
And this is what you specialize in.
That's all we do.
Okay.
Yes.
So now tell us a little bit about the 3D mammography and the Smart Curve comfort technology. I've had the 3D mammography before. This is new to me, Smart Curve.
Yeah. Well, let's just talk about 2D. Just want to compare 2D to 3D. So with 2D, you have you compress the breast. There's your X-ray beam goes through the breast, and all the tissues are kind of superimposed because the 2D mammogram is just one image.
Right.
3D mammogram, you compress the breast, but now you actually go in increments of 1 millimeter. You kind of go through the breast, and you have a much easier time of finding a small white breast cancer, which as I told you earlier, dense breast tissue is white.
Right.
So if you have a lot of white, trying to find something white inside of white, which is hard. Think of it as a deck of cards. You don't know where the joker is in a deck of cards.
Right.
If you now pick up every card individually, you're like, oh, there's the joker.
Right.
That's 3D mammography.
Okay. All right. Now, Smart Curve.
Smart Curve, very important. Thank you. This is the original curve that we used to use. It's flat.
Okay.
Breasts are not flat, as you know.
Right.
The center of the breast is thicker. So in order to compress the sides, you have to put a lot of pressure on the center of the breast, and it's uncomfortable.
Right. Okay.
That's why they came up with a Smart Curve. It's curved. So there's a curve here. This is the thickest part of the breast. It fits as a mold over the breast. It makes for a much more comfortable mammogram.
Okay.
Much more comfortable.
And obviously that's one of the reasons why a lot of women don't like to go in and get tested, because they say it's uncomfortable. So if you can make it a little more comfortable and get an accurate screening, what do you have to lose? Let's go do it.
Absolutely.
Yeah, I love that.
Yeah.
All right, Washington Radiology, we spoke about this just a few moments ago. You guys specialize, this is one of the things that you specialize in, breast cancer, the treatments, the routine. Tell me a little bit more.
So we've been around for over 7 years. We are a multi-modality practice. We don't just do breast imaging, but again, everybody has their niche and does the same thing so that they can provide high quality. accuracy, high-quality imaging, high-quality interpretation is basically what we do.
Okay.
We've had many firsts in the D.C. metropolitan area. We were the first ones to come up with 3D mammography. We started providing that as a service in this area. We were the first ones to provide stereotactic biopsies, and we were the first ones to provide 3D mammography-guided biopsies as well.
And one of the things I like is the friendly staff, because when you go in there, I mean, but think about it, it is a little awkward. You go in there, you've got to take your clothes off. It's always nice to see a friendly face, someone that knows you maybe from the time before, and you can schedule that exam with that same radiologist, and you kind of build up a rapport, and it's nice to have that when you're going in to be tested.
Right, and that's actually a really good point that you bring up, that you can actually schedule with us individually, so you can have continuity of care moving forward, always seeing the same radiologist.
That's good. All right, where do we go for more information?
WashingtonRadiology.com.
All right, Dr. Agnes Holland, thank you for coming in today.
Thank you so much for having me.
We appreciate it. All right, more of